It's me, Mercedes, again, and I'm making another video about being overweight and pregnant. Many doctors will call it obese, and you got to be very comfortable with that word because the doctors, that's basically the language they use, and that's what we are. We are overweight, and the thing is, this video that I'm making is about things that you should talk to your doctor about. Questions that you want to ask him, and how to be really comfortable with your doctor, because sometimes it is hard going to your doctor, being overweight or obese, and really openly communicating with them. There's a lot of doctors that don't want to offend someone that's overweight, so they kind of shy around. They kind of shy around our condition, and it's not really even a condition. They shy around certain things as our weight because they don't want to offend us. And the thing is, if that happens, then your doctor doesn't feel comfortable talking to you, then you actually want to get another doctor. Because you want your doctor to be very open with you. You want them to say, you know what, because you are obese, you're going to have to make sure you do this. You're going to have to make sure you do that. You're going to have to make sure you do this. If you get a doctor that's afraid to offend you, then you're going to have a lot of risks as having miscarriages or, having different things wrong with your baby. So that's why you want to make sure you have open line communication with your doctor. And that's one of the reasons that I'm making this video, is because I had a miscarriage on my first baby. It could have been many things, but I feel that it really was the lack of medical attention because it was my first baby. I didn't know what to expect. You just think you trust these doctors. You think they know what they're doing. But, sometimes these doctors only see you for 5 seconds or 5 minutes. And it's like, okay, you're okay, you're okay. And then things happen. So they have so many patients that you're the one that has to stand up for yourself, your body, and your baby. So those are the most important things that you want to make sure that there's some of the things that we're going to be talking about in this video, how to be open with your doctor. Because there's some things that I've written down. You want to make sure you talk to your doctor, and even though sometimes there's some of us that are overweight that are very confident. I've always been overweight my whole life, and I've been very confident about it. There's some people that were skinny and now are overweight, and they don't really know how to deal with it because they were smaller before. And I understand that completely, I don't know how that is. But if you feel insecure about yourself or anything like that, you have another life you have to think about. So you have to stop thinking about being insecure, and you have to start thinking about, I need to be confident and go in there confident for me and my child to make sure everything's going to go right. So when you go into the doctor's office, you want to be open-minded, completely open-minded with your doctor. And you want to make sure you say it first, because on my first doctor that I had, she was like, I don't know. I think we might have to do some tests. I'm not sure because there might be something wrong. And I was like, what do you mean there might be something wrong? She says, well, you know what? We'll talk about it. I have to talk to the other doctors, and then I'll talk to you about it next week. And I was like, well, no. I need to know now. Why are you saying there's something wrong? And she ended up saying, well, it's not something's wrong. It's just you're really overweight. And I said, well, why didn't you just say that? Why wouldn't you just tell me that? And she's like, well, I didn't want to offend you. I said, you're not offending me. I said, I know I'm overweight, so you're not offending me. So you can have doctors like that. I don't really blame her, but right away I made sure I got another doctor. I didn't stay with her because I wasn't going to be with someone that was uncomfortable. Then I went to another doctor, and that doctor didn't deal with overweight people. Had never dealt with them. So I changed my doctor again. So it was really hard for me to find a good doctor. And the thing is, it's most important is when I had my miscarriage, I was 14 weeks. There's a lot of things that they did wrong with me. They sent me home without a D&C. I ended up having to get 2 D&Cs after that. It just was a huge, huge mess, okay? And I'm still traumatized by it, and I don't want anyone else to go through that. So that's why I'm kind of making the video to answer different questions. And if you guys have any questions, please make sure you comment. I'll try to make videos as much as possible. I'm pregnant too, so some days I'm not feeling well. So I'm going to try to make as many videos as possible. And I hope these really help. That's all I'm making the videos for, is because I really hope that they can help other people that are overweight, obese, and, make this transition or having the baby easy. And, we all need help. I wish I had someone there for me. So, anyways, so you want to make sure you go with your doctor. You're really open-minded. You make sure that you let them know, yeah, I'm overweight. So I need to know what I can do and what I can't do. And what precautions should I take? What don't I need to really worry about? You need to make sure that you're the one standing up for you and your child. Like I said, you want to see if they've dealt with anyone that has been overweight. A lot of times with us being over 300 pounds, the weighers only go up to a certain amount. So sometimes they can't weigh you. In that case, that's not your problem. You have to let them know. What are we going to do then? Because even when people are slender, they always get weighed in, or they get weighed in at least every couple of months to see what their weight is, how much they've gained, and the doctor wants to make sure that, how much they've gained and how much they haven't gained. Because if they didn't gain enough, he needs to let them know. It's the same thing for people that are overweight. The weight needs to be watched. My doctor that I have now, he tried to figure out how to weigh me on their little weighers, and I says, okay, this is not working. What are we going to do? What are you going to do now? He says, okay, the hospital that I deliver at will weigh you there. They took me over to the hospital. He weighed me there. They found out my weight. And so now I at least know my weight. I know if I gain too much, they need to know. And they need to say, you know what? You need to cut back a little bit, or you need to eat healthier. Or you know what? You haven't gained any weight, so okay, that's okay. But if I lose too much, so it's really depends on your situation. But the doctor needs to know your weight. So don't go for, if they can't weigh you or they don't have a weigher, then we need to figure out something on how to weigh you. Okay, so that's really a big issue as far as going to your doctor's appointment and stuff like that. A lot of the time, these places do not have weighers big enough for us. Another thing, these places don't have for people, the clinics don't have. If you have stuff like, people are from different places, but like where we're from, Kaiser's a really big hospital. My sister went there, and she was under my mom's insurance, so she got the privilege of having Kaiser, which Kaiser's a hospital that takes care of prenatal care. And so they have all that big stuff. But if you go to a clinic, and I was always going to these hospitals that have all this stuff and do prenatal care, but now that I'm older, I have to have my own insurance, and now I don't get the privilege of that. So I have to go to a clinic. Now these clinics, they don't have things to measure your blood pressure. So sometimes they do, sometimes don't. All the clinics I've ever been to, they never have anything to do my blood pressure. So sometimes they have to refer you, or you let them know, can you refer me to a hospital? They all have hospitals that they can refer you to, that they work with. So you can always get a referral to go to a hospital and make sure that they have your blood pressure. They take your blood pressure there, and they monitor it. Because with your blood pressure is very important. You can have hypertension. If you have hypertension, then that means you need to go and get pills for that, because that can affect your baby. If they're not monitoring your blood pressure properly, then how are you going to know you ever have hypertension when they don't have anything to properly take your blood pressure? When the thing's almost snapping off, when someone's trying to hold, it's ridiculous sometimes. So you need to make sure that even though they think, okay, let's just get this over with, let's get the money, let's get the check, from the Medicare or whatever your insurance. You don't want to, they're trying to make it as easy for them, but you need to make sure that you show that you're a person, again, that you need respect, and that you need to make sure you're well taken care of. I told my doctor right away, this time around, I had a miscarriage. I want to make sure that this baby happens, because I cannot go through that again. I want to make sure that we take extra precautions. And I told him. So in the beginning of my pregnancy, I see my doctor every 2 weeks, okay? I just recently started seeing him once a month. But once I get to, right now I'm 17 weeks. I'll be 18 weeks this weekend. But after when I'm 22 weeks, I will see him once a week, okay? And people might say, oh, that's just too much or whatever. But no, it isn't. Because we have to remember, is because we're overweight, our pregnancy already is high risk. So there's some women that are slender that have high risk, depending on different conditions, stuff like that. Right away, automatically, it's high-risk pregnancy because you're overweight. And it sucks, but that's the truth. So the thing is that you have to really take precautions, and be really serious that if you want this baby, that you have to be really careful about a lot of things, you know, on how we eat, on what we do. You know, you don't want to overdo yourself because that can be harmful to you. Um, they say that the pool is really good exercise. Drink tons of water. You know, you just want to make sure you have tons of fruit, stuff like that. Excuse me. So anyways, that's something you want to talk to your doctor about. I'm trying to think what else. Those are just some of the things that I can think of right now. Yeah, so I mean, those are some of the things that you do, what I had talked about, that you want to ask your doctor. As far, the ultrasounds. Even though sometimes you don't get, like my doctor, every single time I go in for my visit, he gives me an ultrasound. It's not like a full-blown ultrasound where you get pictures every single time or anything like that, but he makes sure, he checks the baby to make sure the baby's still moving, to make sure everything's okay with the baby. Now, there's some women that they don't need to do that for. You know, my sister, she only had an ultrasound once every 3 or 4 months. And with me, every single appointment, I get an ultrasound. And because we're overweight, they want to make sure that baby is okay. Sorry, there's a fly in here. So that's another thing that you want to make sure that your doctor is doing. Oh, and as far as like gestational diabetes, you want to make sure that you get that taken care of right away. Say that now you have insurance and you never had diabetes before. You want to make sure that they test you personally, because they'll say sometimes, well, we only check if you have that diabetes after 22 or 24 weeks. But you want to make sure you personally don't have diabetes. So they checked that for me. I don't have any of that. So far, it's really good. I have no high blood pressure. I have no diabetes or anything like that. So now when I'm 24 weeks, well, I think they want to check it a little early because I am overweight. I think they want to check it at 20 weeks. And then again, they'll check it at 24 weeks to see if I have gestational diabetes. They say that most likely people that are overweight, they do get them. But I've heard there's some people that are overweight that don't get it. So you really honestly never know, but you want to make sure that you're talking to your doctor, because sometimes they forget these things. My doctor also made sure he took tests of my thyroid, my blood count. I'm trying to think what else. As long as you let your doctor know how much you want your baby and how much you want them to take extra precaution, you'll be able to get the vibe if they're really going to be able to do that. And you can go ahead and proceed from there, if you want to stay with your doctor or not. But you always want to make sure you go to a doctor that you're very, very comfortable with. The same clinic I went to, when I first went there, I seen a woman doctor, and she was nice. She did not know how to give me. They first have to give you like a little pap smear when you first go in to get checked up about being pregnant and everything. They give you a little pap smear. This little lady did not know how to give me a pap smear. Every time I went to the hospital since I was 26 years old, I got pap smears, and they went perfect. I've never had a problem with it. Well, this lady, she tried to give me a pap smear. She did not know what she was doing. She kept trying, and she just wasn't experienced. And then she was telling me, oh yeah, we'll try to do this for you, and I could just feel that she just was not going to work for me. You know, I needed someone that knew what they were doing. I can't have someone that's just starting. I'm sorry, I'm not going to risk my child or myself. No matter, I'm a really nice person, but I'm not going to risk a life on someone that's just starting. So I seen if they had another doctor that had more experience, and they did. So now I go and I see my other doctor, and now my main doctor, my priority doctor, and he sees me all the time, and I talk to him, you know, a lot, and I tell him how, you know, scared I am. I want to talk to you about a little bit about some things that I didn't really know about. But as far as, you know, having sex, some people, you know, we don't know. Can you have sex? What kind of sex you can have? And people don't know that, you know, you can have miscarriages from many different ways. Well, one thing that my doctor had talked to me about was, like, as far as sex, rabbit sex, or how did we say it, Armando? Yeah, jackrabbit sex, where it's just really, really fast and hard. You don't want to do that. While you're pregnant, you cannot have that type of sex. Um, it's just, you can't. So you don't want to use any kind of sex toys. You don't want to use go fast at all. So anything that you do, you want to make sure that you're careful with your child. So you want it to be really slow, And me and my husband weren't really used to that, but we kind of enjoy it now. You go slow. There's different methods and stuff like that, and we don't really have. We do more of foreplay than we actually have intercourse, and it's actually brought us a lot closer and more intimate because of that. And I don't like to have sex a lot just because I want to be careful with my baby. I just, like I said, I had a miscarriage already, and I cannot go through that trauma again. I just can't. I'm still go through that period of losing my baby every day. So it's really, really hard for me, and I just don't want anything to happen to my child. So I take extra precaution about anything that I do. Okay, another thing is too, you want to make sure. I went to the hospital on my first pregnancy, and I told him that there's something didn't feel right. It felt really heavy down in my pelvic area. It just felt really heavy. So I was there for 2 hours. They tried all these tests and everything. They said nothing's wrong with you. It's just probably the weight of the baby. And I was like, are you sure? I don't understand how that could be possible. It just seems unreal that's really the feeling. I've never been pregnant, but just seems, unreal. Well, right 2 seconds before I was going to leave and they discharged me, they found out that I had, what was it, babe? Was it a bladder infection? Urinary tract infection. I actually had that. So they were going to discharge me. They couldn't believe that was still there. And I ended up having a urinary tract infection, so they had to give me medication for that. But if we didn't find out, that I had that can harm the baby too. So the thing is that when you feel your instincts, always believe it. You know your body. We all know our body more than our doctor. I'm a hairdresser. And the thing is, I ask people about their hair because they know their hair more than I do. When they first come to me, once they come to me after several visits, then I know their hair. But the thing is that they know their hair because they've had their hair. They've dealt with it. They know the certain things. They know, okay, I have this cowlick, or, if you do my bangs this way, I'm going to have this cowlick here, or whatever it may be. They know their hair. So the same thing is you know your body more than anybody. You know the things the way it's supposed to feel and the way it's not supposed to feel. So anytime that your instinct, you feel that something isn't right, call your doctor. It's always better to be safe than sorry. And what else? I'm sorry, I'm going on and on. But the thing is just really being comfortable with your weight. Because you have to be very comfortable with your weight, so you know that your doctor's never going to offend you. He knows that you're really open about your weight, so he can be really open about your weight. I'm not open about, saying exactly how much I weigh, but I weigh over 300 pounds. I'm a pretty big girl. But my doctor, I told him right away, I said, this is how much I think I am. And he was just like, really? Like, he couldn't believe that I would tell him my weight and that I weighed that much. He said I didn't look that much. But the thing is that once you're really open with them, then they're really casual about your weight too. And that's the best thing. That's the kind of intimate relationship that you want with your doctor. You want him to be really open of saying, okay, yeah, you're obese and this is what we need to do and stuff like that, because it makes a better relationship. And that's the kind, that's maybe not the kind of relationship you want with your friends or whoever, but that's the kind of relationship you want with your doctor. It's a professional relationship, and he's really there to help you. So this is not the time to be hurt or be offended or anything like that. You need to put all those feelings away and you need to be really confident with your doctor and be really open. And if you're really open with him, he's going to be really open with you. And that's only going to help you again, your body, and your baby. So those are some of the things that I can think of. I can't think of everything. But if you guys have any questions, comments, there's a lot of things that I didn't touch on. Just, please, I would like to help, and that's the only reason I'm doing these videos, because I want to help. Excuse me. Go ahead and leave your questions. Sorry, my throat. Leave your questions, comments, or, if you think I'm doing a really good job, let me know, so that way I don't feel horrible about doing these videos and no one even cares for them. So, I do appreciate your comments. I do appreciate everything. And I hope to make another video. Okay? So, you guys all take care. And again, this is Mercedes. And thanks a lot. Thanks for watching. Bye.